Well, the diagnostic challenges are actually enormous because the problem is not so much schizophrenia in terms of psychopathological articulation, it's more the way we look at it. So we are currently using manualistic definition, which are based on checklist-like elencation of symptoms, which offer you a photograph of a certain phase in the relatively advanced manifestation of schizophrenia spectrum phenotype. So it's a cross-sectional photograph, and it happens in a very advanced phase. So it is unsuited basically to timely recognition, early intervention, and soft psychosocial action when they could really make a difference. And this is important because schizophrenia, it's essentially a neurodevelopmental disorder. It unfolds across the lifetime, and it starts very early with vulnerability conditions and certain environmental situation, especially relational, in the family environment, in the relation with peers, which emit subtle distress signals at the very beginning, but these signals would not be captured by current manuals. And because of that, and because schizophrenia and its condition, they develop over time, and they have a peak in adolescence and in developmental years, and then typically you would have the diagnosis afterward when you're an adult. It's a problematic situation for our diagnostic schemes. Now, what can AI do? AI can do many things. One of them is extract and articulate informations, even just from the clinical file, and present, already a landscape of possibility that sometimes in the mere human recapitulation of the anamnesis can go unobserved or unnoticed. Another thing it can do, especially multimodal AI, is that during the clinical talk and the psychopathological interview, extract further information that are implicit, for example, tonality or the way there is a turn taking in the talk and so on, that are pretty indicative of a certain risk condition, but are not typically necessarily captured from the clinician unless he's a very sophisticated one. And another way is to sort of help the sort of draft and devise a form of support over and beyond the human relation, as sort of, educational tools and therapeutic instruments that are not pharmacologically based or interhuman based. But most importantly, I think it can help us having a better grasp of the evolution of the phenotype since the very beginning. So that's, I think, the most profound contribution. So our own research shows that if you test AI blindly for clinical vignettes that were previously benchmarked with human experts, clinicians, on a global level, almost all the models that we use, even for commercial purpose, are able to make the correct diagnostic ascription. In this way, they do align with the top 33% of leading international psychiatrists that were able to correctly rate both vignette to schizophrenia spectrum disorder. One was very flamboyant, and the other one was a little bit more shaded configuration, which is pretty typical, but it's not yet completely overt, although with a strong clinical help seeking. So in this case, it is pretty evident that this tool, when they are provided with basic information, they can present the clinician with a sort of cockpit of aspects that should not be overlooked when making the clinical evaluation. So in principle, for example, this kind of support would help normal clinician to reduce the risk of misdiagnosis or underdiagnosis, because the AI would present with elements that should be taken into consideration and pondered in the case formulation.